Now just straighten your arm down towards your knee, hard. Okay, that's good. And this side, down towards your knee.
Wrist flexion. The patient should bend the wrist and not
Put your
allow
wrist
you to
down like
straighten
that.
it.
Don't let me straighten it up. Okay, and this side. Keep it flexed. Good. I'd like you to put your wrists, cock them up straight.
The patient
like
should
that.
extend
Hold
the
them
wrist
there.
and not allow you
Don't
to
let me
bend it.
straighten them. That's good.
Finger extension. The patient should straighten the fingers and not allow the examiner to push them down.
Now you put your fingers straight out and hold them there. Good.
Finger flexion. Ask the patient to squeeze 2 of your fingers.
I'd like you to just
Never
squeeze
offer
hard on
3.
my fingers. Now again, squeeze these hard, don't let me take them out. That's good. Okay. On your
Finger
knee,
abduction.
just spread your fingers
The
apart
patient
like
should
that.
spread out the fingers and not allow you to push them
So
together.
don't let me push these fingers together. That's good. And spread these fingers apart, just rest them there. Again.
Finger adduction.
There, resist
Ask
me
the
pulling
patient to
them
keep the fingers together against
Okay,
your
and
attempts
now
to
we're gonna do the
separate
other
them.
side. And resist me pulling your fingers apart. Resist.
Now test for an ulnar nerve lesion,
That's good.
Frohman's
I'd
sign.
like you to hold this card
Ask the
as I'm
patient to
doing
grasp
it,
a piece of
and
paper
keep
between
a
the
good
thumb
grip on
and
this
lateral
card and
aspect
don't
of the
allow me to
forefinger
remove it.
on each hand. If the sign is positive, the affected thumb will flex because of loss of its
This side
adductor
here.
muscle.
Again, grip it tightly. Hold it there. Good, thank you.
And now test for a median nerve lesion, pen touching test. Ask the patient to lay the hand flat, palm upward on the table, and attempt to abduct the thumb vertically to touch the examiner's pen held above it.
Now hold that thumb in
This
that
may be
position.
impossible
Don't
if
allow
there is a
me to
median
bend
nerve
it down.
palsy at the wrist
That's
or
good.
above.
And on this side, again, touch the tip of the pen, gets your thumb in the right position, and now hold that there and don't let me put it down. Yeah. Okay.
Now test the
I'd like you just
reflexes.
to fold your arms
Begin with the
loosely like
biceps
that,
jerk.
and just
Place one forefinger on the biceps tendon and tap this with the tendon hammer. The hammer should be held near its end and the head allowed to fall with gravity. Normally, if the reflex arc is intact, there is a brisk contraction of the biceps muscle with flexion of the forearm at the elbow. This is followed by prompt relaxation. If a reflex appears to be absent, always test following a reinforcement maneuver. For example, ask the patient to clench the teeth tightly just before you let the hammer fall.
Okay, I'd like you to clench your teeth very tightly, please. Go now. And relax. Do it again. And relax.
Now test the triceps jerk. Support the elbow with one hand and tap over the
hold your arm
triceps
like that.
tendon.
Stay loose.
Normally, triceps contraction results in forearm extension.
And again, just relax this arm right there.
The brachioradialis or supinator jerk is next. Strike the lower end of the radius just above the wrist. To avoid hurting the patient by striking the radial nerve directly, place 2 fingers over this spot and then strike the fingers. Normally, contraction of the brachioradialis causes flexion of the elbow. Now test the finger jerks. The patient rests the hand palm upward with the fingers slightly flexed. The hammer is struck over the examiner's fingers, which have been placed over the patient's. Normally, slight flexion
That's
of
right,
all the
sir.
fingers occurs.
Just relax your fingers there.
Examination of coordination tests cerebellar function. Begin with the finger-nose test. Ask the patient to touch his or her nose and then your outstretched finger.
I'd like
Demonstrate
you
the
to touch your
movements.
nose. And now reach out and touch my finger.
Look for
And go back
intention
and
tremor,
forth as
which
quickly
is
as you
tremor
can.
increasing as the target is approached, and for past pointing, where the patient's finger overshoots the target towards the side of the cerebellar abnormality.
Let's try the other side. Okay, that's good. What I'd like you to do is on the back of your hand, I'd like you to take your other hand and to alternate front and back like that, and then go as fast as you can.
Now test the patient's ability to perform rapidly alternating movements.
The
Slow
other
and
hand
clumsy
now, I'd like you to do the
performance
same
of these
thing, but
movements
lift
is
it up
called
before you go back down.
dysdiadochokinesis.
Okay, right, Rich, what I'd
Now
like you to
test
do this
rebound.
time.
Ask the
is
patient to
with
lift the arms
your
rapidly
arms
from
by
the
your
sides and then stop.
And then you're going to lift them straight up with the palms up
Hypotonia
like that,
due to
and you're gonna
cerebellar
stop in that
disease
position.
causes
So
delay
you need to do
in
it with
stopping
your
the
eyes
arms.
shut, and you do it quickly. Okay.
Remember that muscle weakness may also cause clumsiness,
Okay, and
but
once
motor
more.
testing should have revealed any impairment
Okay,
of this
thank
sort.
you. And can you put your arms straight out now? And now just close your eyes and hold, and keep your hands in that position, even though I'm going to try to move them. Okay, thank you.
It is usually best to examine the sensory system last. It can be a difficult examination because it is subjective. Look for scars that may have caused nerve damage. First test the spinothalamic pathway, pain and temperature.
What I have here is a pin. It's been blunted, so it shouldn't hurt, but it should still feel sharp. And I'm just going to demonstrate it by touching your chest. Now, does that feel sharp?
Yep.
Okay, and does it feel sharp on this side? Yep. Right, I'm going to be touching you on your fingers and various parts of your hands, and you just tell me when you feel it is sharp, but your eyes need to be shut. Okay? All right.
Yep. Sharp.
Test each dermatome. Map the abnormal area and fit any sensory loss into a pattern. Test that the patient understands that the sensation should be sharp by turning the pin over and touching with the blunt side occasionally. Always use a disposable neurological pin. It is not usually necessary to test temperature. Next, test the posterior column pathway, vibration and proprioception. Use a 128 Hz tuning fork to assess vibration
So with
sense.
this, tell me, what do you feel when I put it there?
It's vibrating.
Okay, and on this side?
It's vibrating.
All right. Now, I'd like you to close your eyes, and I'm going to actually touch your fingers, and you just tell me when you can feel it.
Yeah, it's vibrating.
Now, what I need you to do is tell me when it stops.
It's stopped.
Okay.
If the vibration sense is absent distally, try again on the wrist, elbow, and if necessary, the shoulder. Now examine proprioception, starting with the distal interphalangeal joint of the little finger.
I'm going to push it down. All right, with your eyes closed.
Down. Down. Up.
Okay, I'm going to try this side. Keep your eyes shut.
Up. Down.
Movement of a few degrees is usually detected by the patient.
This is a cotton ball, and I'm going to do the similar.
Test light touch with cotton wool. Touch the skin lightly, but do not stroke in each dermatome.
Okay.
Yep. Yep. Yes. 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 Yep.
Did it feel the same on both sides?
Yes.
Okay.
The neurological examination of the lower limbs.
Nice to meet you. I'd like to examine your legs, and we're going to begin then by seeing what your walking is like. Okay. So if you wouldn't mind just hopping out of bed, please, and just stand up by the edge of the bed. Do you feel steady?
If the patient is able to walk, start by examining
just walk to the
gait.
end of the wall.
The legs need to be uncovered. Use this opportunity to make a general inspection.
Thank you. Stop right there. Turn around and just come back towards the bed again. Okay, stop there. What I'd like you to do now is to walk with your heel
to toe walking is a test of cerebellar function. Look for unsteadiness and any leaning to one side. Is the gait typical of any particular abnormality?
What I'd like you to do now is to stand on your toes and to take a few steps.
An S1 lesion makes this
Oh,
difficult.
that's good. Thanks. And now just on your heels and take a few more steps.
An L4 or L5 lesion will make this difficult.
All right, just come this way. You can turn around. And what I'd like you to do now is to squat like this.
A proximal muscle weakness will make this difficult.
Okay.
Now test station. Stand close enough to the patient to steady him or her if necessary.
Even your feet completely together like that. Good. And your hands straight out like that with the palms up. Now I'll be close in case you become unsteady.
Slight swaying is normal, but marked unsteadiness when the eyes are open suggests cerebellar or vestibular disease. Romberg sign is positive if unsteadiness increases markedly when the eyes are closed. It is a sign of proprioceptive loss.
All right, that's very good. All right, open your eyes, and if you wouldn't mind just hopping back into bed.
Now ask the patient to lie down. Keep the legs exposed. Look for muscle abnormalities and fasciculations and tremor. Test tone at the knees and ankles.
I'd like you to stay just very loose so I can roll your leg and flop and be loose and floppy. That's good.
There should be little muscle resistance to these movements if the patient is relaxed.
And stay loose for me. Very good.
Next, test for clonus of the ankle and knee. This is a
Stay
sustained
loose
rhythmical
again.
contraction of the muscles when put under sudden stretch. It is due to an increased muscle tone. Patellar clonus is tested next. Now test power. Start with
What I'd
hip
like you to
flexion.
do is lift this leg straight up in the air. Push hard against me. Push hard. That's it. Good. And this leg. Push hard up. Good.
Then hip extension.
Now, I'd like you to drive your leg back into the bed. Push down hard. Okay. And again, push down hard.
Now hip abduction.
Push your legs apart as firmly as you can. That's it. Good.
Now hip adduction.
Again, pull your legs together. Good.
Now test knee flexion.
I'd like you to bend your knees for me. Bring them both up. Good. Now hold it in that position and don't let me straighten it. Hold it. Good. And this one. Hold it in that position. Good.
Now test knee extension.
Now straighten your leg for me. Push out. Kick out. That's it. Kick this leg out. Good. You can straighten your legs again. Down.
Now test the ankle joint. Plantar flexion.
What I'd like you to do now is to press your foot down against my hand and your toe as well. Curl your toe down. Good. Push this foot down, toes as well. That toe as well. Push down hard.
Dorsiflexion.
Now I'd like you to bring this foot up towards, or toes up towards your face. Foot and toes. Good. And this one. Toes and foot.
Now test the tarsal joint. Eversion.
What I'd like you to do
Inversion.
now is to put your feet out, away from each other like that. That's it. Keep it in that position. Push out. Good. Now put your feet in so that they face each other. More like that. Relax a bit. More like that, so that they're facing each other. That's it. Hold it there. And hold it there.
Now test the lower limb reflexes. Begin with the knee jerks.
Okay. Well, I'd like you to be relaxed again, and let me just take the full weight of your leg. All right,
Normally,
stay
contraction of the quadriceps causes extension of the knee. Compare the two sides. If the knee jerk appears to be absent on one or both sides, it should be tested again using a reinforcement maneuver.
All right, stay right there.
The ankle jerk is tested next.
Relax your leg. Keep it loose.
The normal response is plantar flexion of the foot with contraction of the gastrocnemius muscle. Again, test with reinforcement if necessary. This reflex can also be tested with the patient kneeling.
What I'd like you to do is sit up for me, and you'll have to kneel on the edge of the bed with your ankles hanging over the back, and straighten yourself up. Are you okay like that? All right, just hold that position.
Now test the plantar reflexes.
Richard, this is going to be a bit uncomfortable. I'm going to be scraping the bottom of your foot.
Stroke up the lateral aspect of the sole and curve inwards before the key reaches the toes, moving towards the middle metatarsophalangeal joint. The normal response is flexion of the big toe at the MTP joint.
Okay, thank you.
Coordination is tested next. Start with the heel-shin test.
What I'd like you to do is put this heel on that knee. Yep. And now go up and down the crest of your shin. All right, thank you. And
In patients with cerebellar disease, the heel wobbles and oscillates from side to side. Now perform the toe finger test. Look for intention tremor.
reach up with your toe to try to touch my finger. Just hold it that position. That's good, thanks. And try it with this side. That's good, thank you.
Now perform the foot tapping test. Look for loss of rhythmicity.
Can you tap my hand with your foot? Just tap it quickly if you can. That is good. Now try this side. Okay.
Now test the sensory system. As for the upper limb, test for pinprick sensation first in each dermatome, comparing the right with the left side. Map out any abnormality and decide on the pattern of loss.
What I have here is a neuro tip. It's a blunted pin. It should still feel sharp, but it won't break the skin. And I'm just going to demonstrate here. Does that feel sharp? And on this side? Okay. I'd like you to now to close your eyes. I'm going to touch your legs in different places, and you just tell me if you feel it and if it is sharp. Okay. Sharp. 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 Yep. Sharp. 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 Okay. Yeah. Sharp. All right. I'm going to check the other leg.